in India. And we try to understand the historical context of this entire health policy, how it evolved. And in that connection, we discussed about Bore Committee recommendations of having primary health center. Then we also discussed about CDP, Community Development Program. And then we also try to focus on different aspects of how community, how health was an important factor. And we, in this connection, we also touched upon 1983 National Health Policy and 2017 National Health Policy. And we were very clear about one thing, that exclusive reference, even if is not there, there are many components of national health policy which directly and also to a great extent indirectly relate and connect with women's health. And we also saw some important videos with regard to especially how menstrual hygiene is becoming one very, very important factor. And we also saw the other video basically to emphasize that you remain connected with what is happening at the grassroots level. And in that connection, this video is very important for you. Now, let me share this screen. 1 second, please, just 1 second. Yeah, I'm sorry. I'm sorry for this disturbance. So let me share the screen first. Where are we? So this is where we were trying to, we spoke about menstrual hygiene. And in menstrual hygiene and health, we were trying to understand that how awareness programs become so important to break the stigma also. Now, very challenging thing is how we can improve the accessibility and quality of healthcare. Okay, especially when it comes to remote areas, interiors where it is difficult to control the various aspects connected with providing very, very complex support, medical support. Let us say if it is a surgery or other such things. So that mechanism of providing holistic and very effective healthcare in remote tribal areas or rural areas even today is a challenging task. Then we also have lot of cultural barriers here. So when you talk about cultural barriers, see friends, like uh, most of us who are living in cities, probably we might find this as very irrelevant. We might think that if someone is sick, they will have to go to the doctor. It is as simple as that. Why will any person refrain oneself from seeking any kind of medical help? But it is a reality. It is a fact that in culturally sensitive societies where women's health is definitely not a priority, the domestic work, the household chores become more significant when compared to women's health. And in this connection, I would also like to uh, bring into discussion that whether it is menstrual health, whether it is even various aspects connected with reproductive health, even with regard to sexual intercourse also, there are many perspectives where women are having a raw deal when compared to their male counterparts. So culturally, what happens that in that entire journey of looking after the family or being more focused on the career, or if you are in a family which is in a remote area, and not much of awareness is there, then many things connected with your health will not be given significance. Even you yourself don't consider that it is important. And cultural factors, as a result, play very, very important role here. In fact, see, in many cases, this is a reality in many cases. When the woman has to deliver the child, okay, even doctors are also reporting that um, muhurt is being seen to deliver the child so that that male preference, son preference concept is still very strong in our Indian society. Though girl child daughters are increasingly being accepted, but we cannot completely deny the fact that son preference is one important concern in Indian society. And that is why it is also said that if you are undergoing labor pain or you're undergoing C-section on that said Muhurat, probably you will have a male child. Such kind of superstition is also there. And in such cases, the family members themselves tend to play with the health of the pregnant woman and her child. So cultural factors definitely have to be considered when we are talking about health policy and women in India. And then high economic constraints. See, though we have a significant, what do we say, uh, public health care system, but with the growing population, that public health care system, to what extent it is meeting the needs of the people is also matter of discussion. Private hospitals, again, is very, very costly, and we know that how private hospitals are also charging so excessively, though some of them they are protected under schemes like Arogya Shri or schemes like Ayushman Bharat, but still, in some cases, providing for people who do not come under the beneficiaries of this scheme and they are not also belonging to elite class, rich class, for them undergoing medical treatment becomes very, very difficult. Now, though now you can definitely counter my point saying that we have medical insurances which can take care of the medical expenditure. But the million-dollar question is how many citizens in our country have health insurance, medical care insurance? How many people are in a position to get reimbursement? In many cases, like in critical diseases like cancer or kidney transplant or liver transplant, yeah, or any kind of cardiovascular diseases, the expenditure of the entire process sometimes literally breaks your spine. So economic constraints also can be one very, very important factor with regard to assessing the women's health and making sure that women get the best medical care and they get the best possible facilities which are also economically feasible. So this is one serious constraint which is equally applicable to the male and female. This thing we have to keep in mind. Then awareness is not there. Like in yesterday's video, which we were seeing on your menstrual hygiene, right? In that, we were seeing that how there's so much of taboo attached with it. Women are still using cloth. Sometimes, to what extent the cloth is washed clean in a clean way or how that is being disposed. So that is also leading to another set of challenges also. Now, though there are schemes of distributing sanitary napkins at a very, very affordable price, in some cases, 1 rupee a pad, or in some cases, free distribution of pads, these are serious concerns. And then again, when you talk about maintaining gap between the children, family planning. Women are also not aware that what can be the best possible ways. And of course, in urban areas, lot of open talk is happening on this. Open conversations are taking place in this regard, but still a lot is yet to be achieved. And some of the recent developments, my dear friends, with regard to health policy and women in India, this I was already talking to you, Ayushman Bharat. So it was launched in 2018, and basically this scheme aims to provide health insurance coverage to over 100 million vulnerable families, ensuring access to secondary and tertiary healthcare services. So this is one such initiative by the central government. In fact, many state governments, including in Telangana, we have scheme called Arogyashri, which is providing health insurance to people in Telangana. But again, what is the coverage? How many, the coverage is required for more number of people, but beneficiaries are still very, very restricted. Then lot of digital health initiatives have been taken up, and the government is promoting digital health services so that we can reach out to the remotest area. And in this connection also, we have discussed about some very interesting telemedicine experiments which are already going in India, and how technology is being used to not only track the cases but also to manage the data. And also we are using artificial intelligence also to address the challenges in this regard. So lot of development has taken place. See, we should not look at things from the point of view that nothing has happened. I think that's a very, very negative approach, that nothing has happened. Lot has happened, and more is yet to happen. I think if we are maintaining this line of thought, we will also be able to appreciate the efforts of the people who have who are really working day in and day out. Imagine, especially during COVID period, when most of us were trying to isolate ourselves in our homes, it was our healthcare workers, all our frontline workers, our paramedical staff, our nurses, our doctors, who were into direct contact with the people who were infected. Wearing those PPE suits was such a challenging task. They themselves sweating round the clock, and again, when they want to reach out to their family, many would stay in the hospital. So all such challenges are there in front of us. And when we say that no, nothing is happening in healthcare, I think we are undermining the efforts of hundreds and thousands of such people. You imagine the paramedical staff. You take the example of ambulance drivers. You take the example of our, probably the sweeper who were working in the hospitals. So when we are undermining, when we are saying that, okay, nothing is happening, then all the efforts which is made by such kind of paramedical staff, or support staff of which is associated with medical care, we are undermining their efforts. And lot has happened, which we are yet to go a long way. And it is very, very important that continuous efforts are made to ensure that healthcare services are accessible, affordable, and of very high quality for all the women across the country. And that is why our responsibility uh, is not only to make sure that the healthcare is accessible to the most remotest corner, but it is also of good quality. And it is a very, very important indicator of the development. So healthy women contribute to healthy families and communities. This is the most important takeaway from this. Now, friends, I would also like to just screen share. Let me stop. Let me see if I can share the one which I want to show you. Yes, I think I'm able to show you this. This is a very, very important policy document. Basically, this is a official communication which is given by Ministry of Health and Family Welfare, and this is released on 8th August 2023 by Press Information Bureau. And what are the steps taken by the Government of India to improve women's health? So I thought this is a very, very important document which I should show it to you so that you understand that uh, when we are being critical of everything, most of the times probably we are not aware of any such thing, right? And that is why I just want to take some time for us to enable this discussion. So, first point, what it is talking is comprehensive primary health care through Ayushman Bharat Health and Wellness Centers. And in 2018, the Government of India announced 1,50,000 Ayushman Bharat Health and Wellness Centers, which was to be established by 2022. So, in 4 years' time period, the target was set to establish Ayushman Bharat Health and Wellness Centers. So the existing sub-health centers, primary health centers, urban primary health centers are transformed into Ayushman Bharat Health and Wellness Centers so that a comprehensive healthcare can be delivered. And the data, as you can see, by 31/7/23, a total of 1,60,816 health and wellness centers, Ayushman Bharat Health and Wellness Centers were established in our country. Now, health melas to be organized. Now, what is the significance of these health melas? Basically, the purpose is to spread more awareness about the healthcare services. Friends, believe me, even today, uh, lack of awareness is one of the most critical challenges with regard to healthcare in India. Just give me a second, please. Right. So Ayushman Health Melas are one-stop platforms for what? To address a comprehensive range of health issues which have proven to be an effective strategy to reach the masses and augment the utilization of healthcare services. Teleconsultation services are also provided as part of it. So this is something very interesting. No? Healthcare services, you are providing teleconsultations, you are providing, and just see, data is also important because you're providing teleconsultation, very good, but to what extent? So the data is suggesting that by 31st July 23, more than 14.35 crore teleconsultations have been provided via e-Sanjeevani portal. I'm sure most of us are not aware that such portals exist, including myself. In many aspects of this information, I came to know just couple of months back when out of my own interest, when I was started exploring how it is, and I was really surprised that so much that so much of development is taking place at grassroots level. Unfortunately, there is no awareness. Then, along with the health mailers, teleconsultation services, National Free Drugs Initiative is also taken up. So they are supported to provide essential drugs based on level of public health facilities, free of cost to all who access these facilities. So there is also provision to provide drugs free of cost, the important medicines free of cost. Free diagnostic initiative. So if you are having any kind of health concern, diagnosis itself can be a costly affair. But as part of this particular initiative, free diagnostic service is also provided. National ambulance services, where technical and financial support is provided for emergency medical services through a functional national ambulance service network linked with centralized toll-free number 108 or 102. National mobile medical units are also being provided at different places to facilitate that better healthcare can be provided. Then, apart from the above schemes, government is also implementing these schemes, especially for pregnant women. So this we have already discussed. I will not go so much into detail. One or two things which we have not discussed in yesterday's class, I would focus my discussion more on that. Surakshit Matritva Ashvasan, like this is Suman, which provides assured, dignified, respectful, and quality healthcare. Janani Suraksha Yojana we were discussing in yesterday's class, and under Janani Shishu Suraksha Karyakram. So not only Janani, that is pregnant woman, but also the Shishu, the child. So what is Janani Shishu Suraksha Karyakram is saying that every pregnant woman is entitled to free delivery, including cesarean section in public health institutions, along with provision of free transport diagnosis. Then Pradhan Mantri Surakshit Matritva Abhiyan, which we mentioned in yesterday's class, they were pregnant women a fixed day free of cost assured and quality antenatal checkup by a specialist medical officer on ninth day of every month. What is this Lakshya trying to do? Lakshya is trying to improve the quality of care in labor room and maternity operation theaters to ensure that pregnant women receive respectful and quality care during delivery and immediate postpartum. Because see, delivering the child can be a very, very, what can I say? It's of course, like if it is a normal delivery, it is a painful process. But again, there's some kind of contentment that you are giving birth to your child, that is giving lot of courage and motivation to women to undergo that pain. But overall, how that process the woman is undergoing, that should include a lot of dignity and lot of respect, irrespective of whatever background the woman is coming from. That is very, very important. Functionalization of first referral units to ensure manpower, blood storage units, referral linkages to improve the access to quality of care for pregnant women. Then we are also having outreach programs. Such as part of outreach programs, are provision for improving the reach of healthcare services, especially in tribal and hard to reach areas. So this is what I was talking there. It is very important that how are you ensuring access to healthcare. So if specialized initiatives and efforts are not taken care to reach out to the most remote or most, what can I say, isolated maternal and child health services, community mobilization, as well as to track high risk pregnancies. So in remote areas, tribal areas, the pregnancies which is having relatively high risk, probably due to various reasons, such kind of pregnancies also to provide all the possible safe and secured labor to the woman, and so that the childbirth, the delivery is taking place in safe and secured environment, ensuring that both mother and child are happy after the delivery. Even that is one of the most important goals of these outreach programs. Then you also have IEC, BCC campaigns, where one key focus area is maternal health is to generate demand through information, education, and communication, interpersonal communication, and behavior change communication activities. So see, um, when the childbirth takes place and finally the child is in the world, but our behavior might not modify overnight. Okay, so uh, how the new mother should be, yeah, behaving in the sense what kind of care she should be taking about herself, what kind of care she should be taking about her child. All these things has to be also be part of that awareness campaign. So as part of that awareness campaign also we will see that lot of efforts are being done by government of India. So all this is part of the official reply, okay, which was given by State for Health and Family Welfare, SP Baghel, in his Rajya Sabha, and this data pertains to 8th August 2023, almost all about uh, 9 8 9 months before it. So I hope, friends, you got a perspective there. How much effort is being done and taken care with regard to making sure that women's health remains the top priority, and many components are being included as part of national health policy also. And at the same time, there are women specific initiatives, like all the initiatives what we have seen just now. All these initiatives are directly indirectly connected with women's health. So I hope this particular topic is clear. Now we are going to start discussion about our last unit, last topic, which is talking about. I'm sorry, there was some network issue, so there was just brief problem, not a major problem. Right. Yeah. So this is the last topic of our syllabus, where we are trying to understand about the economic policy and how it has impacted health and women. So before I go into details of how this economic policy is impacting women and how specifically with regard to health of the women, we will try to understand basically what exactly happened as part of the economic policy. As you all are aware, my dear friends, economic policy happened in 1991, right? And this brief video will help you to understand what exactly was this new economic policy, what are the important aspects connected with this new economic policy. Though it happened in 1991 July, its impact is far reached impact. So let me show you that video. It's a brief video of about 6 minutes 35 seconds, and then we will go ahead with our discussion. So, friends, I hope you got a feel of what exactly was economic reforms all about. See, basically, our topic is not on economic reforms, right? But we have to understand one thing, as we are seeing in the video, that the impact of economic reforms was felt on every aspect of social life, whether it was your education, agriculture, your healthcare sector, almost every dimension of our human life and social life underwent drastic change, and healthcare was no different. Now, in the entire video, one word which literally is the takeaway of the entire about 5 6 minute video, that is privatization. And that is where privatization, why we are doing privatization? Because we wanted to liberalize the economy. So when you are liberalizing the economy and you are allowing foreign companies to come to our country, so you are basically easing out those license process, and that process completely is termed as liberalization. So because of this liberalization, there was also privatization. You were encouraging, you were inviting the private hospitals, private companies to be part and parcel of your society, your day-to-day functioning. And this is one thing which had lot of impact with regard to women overall, and impact is both positive and negative. So it's never that reforms can always be positive or always can be negative. So as students of sociology, as students of social sciences, our responsibility is to assess and analyze that what were the strong areas, what were the weak areas. So with this contextual introduction, let us start discussing about this topic. Now the screen is visible. So new economic policy of 1991 included standard structural adjustment measures, including devaluation of rupee, which we just saw in the video, increase in interest rates, reduction in public investment and expenditure, reduction in public sector food and fertilizer subsidies, increase in imports of foreign investment in capital intensive and high tech activities, and abolition of the cash compensatory support for exports. So, in this entire point, one very important point which had straight bearing on the health sector is reduction in public investment and expenditure. So public, when you talk about healthcare, major part of healthcare prior to 1991 reforms was by and large public health sector. The presence of private hospitals was very limited, or limited to the extent of being called as negligible. And these policies, so now these policies were in a way mandatory to address the economic challenges of our country at that point of time. But if you see the impact of these policies, this was this impacted in what you call as increased urbanization, because when foreign companies are coming to India, they will definitely invest in the cities. They will not go to villages and invest, because villages will lack the infrastructure. So when they are investing in cities, opening their offices in cities, opening their multinational companies in cities, that will further propel the process of urbanization. So, and why this is happening, when let us say more and more companies are coming and opening their offices in city, it will also require manpower. That is how migration takes place. More and more urban facilities have to be upgraded, and fewer job opportunities for women in the formal sector. This is one very important aspect which also had impact on the health aspect of women. Such conditions increase poverty for women in particular. In fact, there is some amount of research which has been done to explore and understand that how economic reforms led to poverty. And whenever you are talking about poverty, definitely we come across the concern of feminization of poverty. So poverty impact on women is relatively very higher when compared to that of men. So as a result, many women flow into cities looking for work in the informal sector. So when formal sector jobs are getting restricted or limited, then women try to explore opportunities in informal sector. This may have increased number of women in sex work for lack of better economic opportunity. So, see, this is from one of the papers, one of the research papers. Probably I'll be able to share details tomorrow. Immediately, I'm not able to recall. In that paper, a research was done that how economic reforms have impacted women, especially with regard to HIV/AIDS. So some of these points are from that research paper. In fact, extensive research is not available. Like lot of review of literature, even I was trying to do to understand. But whatever is available, what are the main key points? Let us focus on that. So, what the researcher is trying to communicate is when more and more informal sector expands and there is entry of women in informal sector will not offer very lucrative kind of a livelihood. There are many challenges. Probably the right kind of wages are not paid, right kind of facilities are not provided, and that is where her economic challenges increases. And in many cases, women are forced to take up sex work, especially with regard to informal sector. But see, as the researcher also accepted that sufficient data is not available to confirm whether HIV infection rates have risen as a result. However, the evidence suggests there may be a relationship between macroeconomic policies and health outcomes. Now, let us go back to 1991. For a moment, let us assume, like of course, lot of exclusive research on health women is very restricted. On the basis of the available literature, what we have, if we try to analyze this entire process, imagine there is a sudden like privatization of economy. You are competing, you were very comfortable in your public sector mode of functioning, and suddenly there is privatization of economy is taking place. More and more of foreign direct investment is taking place, because of which foreign multinational companies, private companies, they are coming to our country, and you overnight you are expected to compete with the international companies. So the level of competition, the level of challenge is very high. The stakes are very high for that matter. If you are able to compete, if you are able to generate the same kind of quality and same kind of demand for the product what you are selling, the brand which you are trying to promote, then there is no problem. But if you are not able to compete, if you are not able to uh, uh, take your level to that of international players who might have had their offices all over the world, and they have lot of experience of doing international business, and we as a retail outlet we might not have so much of experience, then imagine the level at which you are competing. So naturally this will impact not only like not only women indirectly. First, at first level, the impact is indirect. The direct impact, let us say, even if it is at the family level, then your economic crisis increases because it takes time for you to get adjusted to new kind of reforms. Your adjustment will not happen overnight. So from 1991, now if you see 2024, probably we can definitely say that economic reforms laid the foundation for a more globalized India. Now we are in the process of globalizing. Complete globalization has not taken place. So in this again, during COVID period, there was emphasis on self-reliance. So all these macroeconomic policies, they will definitely impact all the citizens, and in specific areas, women of the country also, women citizens also. You will not be able to, refrain yourself from that impact, because this macroeconomic policy is impacting the entire ecosystem in which I am living, in which I am operating, in which I am deriving my livelihoods. It is not possible for you to completely refrain yourself from that. And that is why when you're talking about health and women, we have to discuss topics from that perspective also. Right. Now, some very important components which I have taken from the available literature, which I would like to share with all of you. So, the economic survey presented to the Parliament in 1996 states that after the introduction of economic reforms, central plan outlay for programs of Department of Health has been stepped up from rupees 302 crores in 92-93 to rupees 670 crores in 95-96 period. So here we are seeing that probably in span of 3-4 years, the overall, what you say, plan outlay or financial plan outlay by Department of Health, it is increasing drastically, more than double has been allotted. And a large percentage of these funds are earmarked for the control of communicable diseases such as malaria, tuberculosis, leprosy, blindness, and later even AIDS was also added as part of it. So see, out of 670 crores, 421 crores was for exclusively these challenges and also providing the salaries for the people who are working to maintain this particular kind of arrangement. So what picture are we getting out of it, that when in 1996, 95-96 health plan, the focus was on communicable diseases. The focus was less on non-communicable diseases. And to what extent this also impacted women's health is also matter of discussion. Because when you are not exclusively segregating that this much amount should be taken, should be allocated exclusively for women's health, then when such clear-cut segregation is not there, then probably overlap of funds will also take place. Now, see, this point is very, very important because this is that point which probably uh, is a milestone point with regard to the fund allocation with regard to exclusive women's health. So, what is that point? Let us try to understand. In the country report prepared for the Fourth World Conference on Women held in Beijing in 1995, the government of India acknowledged, see, this is a very, very important point, acknowledged that due to the new policies, means new economic policies, overall the economic pressures may compel households to resort to various difficult survival strategies. Further, the anticipated reduction in services implies that women may also have to allocate more time to activities that were previously at least partially provided by the state. Now, see, this is a very critical point. Why am I using the word critical? Because on one hand, it is being acknowledged that we are not in a position to, provide that kind of backup, that kind of uh, support from the government. And because that kind of support is not being provided, there is greater pressure on the citizens and probably to the extent of like more survival strategies becomes very, very difficult. Okay, so now when you're talking about survival strategies, then imagine the kind of pressure on common man, how intense it would be. So in this perspective, I'm using the word critical. Second thing, what I'm trying to say, that the anticipated reduction in services. Now see, if anything is happening, its impact on domestic household work is massive. It is intense, right? So This anticipated reduction in services also led to that, women had to take up those activities, allocate more time, more efforts, right, which was probably taken care by the state. Now, it is definitely a debatable thing that we can list out that what are the things which the state was providing earlier, and now the state is not in a position to provide now, and that is where there is more impact on women. We can definitely list out those things. So the crux of the matter is the various provisions which were part and parcel of new economic policy, to be more precise, LPG or economic reforms. So there are two key takeaways here. First thing is those policies were basically meant to strengthen our economy, which was at a very, very difficult state. And second thing is it impacted all the aspects of our socio-economic life, including health sector. And when you're talking about including health sector, women's health or women in particular, if you focus, the impact was much more because there are a lot of studies which have been taken up to communicate that poverty initial years, the impact of economic reforms led to a lot of challenging situations and increase in poverty. So this will also impact women to a great extent. So, friends, I think I will rest with this for today's class because we are almost at the fag end and we are left with one more class tomorrow. So, remaining discussion we will take up in tomorrow's class. And I will also quickly try to summarize what are the key takeaways from this particular paper. I just want to thank each one of you for joining for today's class. And I really wish there was some mechanism for us to interact so that there was provision for us to understand each other's doubts and clarify each other's doubts. So, friends, thank you all so much. And I also thank the host from Dr. B.R. Ambedkar Open University for facilitating this online class. Thank you all, friends. See you all tomorrow at 8 o'clock. Tomorrow will be the last class for this particular paper and this particular paper connected with women's health, which is part of this diploma. Thank you all. Take care. Good night.